Welcome to the AANEM Neuromuscular Ultrasound Instructional Video Series. This demonstration will review ultrasound evaluation of the sural nerve and relevant local anatomy. This video is for educational purposes only. Participants should not rely on this content to make medical decisions. It is the responsibility of the participant to exercise sound professional judgment and ensure acceptable knowledge and experience before applying these techniques in clinical practice. The AANEM and presenters of this material do not assume responsibility for any injury or damage to persons or property pertaining to the use of the information in this resource. A complete scan of the sural nerve comprises the nerve's course from distal to the knee to the lateral foot. We will focus our scanning in short axis view to the nerve. However, the nerve should always be observed in both short and long axis orientations, particularly at sites of focal enlargement or abnormality. The sural nerve is a pure sensory nerve that provides no motor innervation. It innervates the cutaneous portions of the posterolateral leg, lateral heel, and dorsolateral foot. To begin this scan, the patient is positioned prone on their belly. A linear ultrasound transducer with a high resolution should be used for optimal imaging. The sural nerve is best visualized initially at the level of the ankle. To find the sural nerve, the transducer should be placed short axis at the posterior aspect of the lateral malleolus. At this location, the sonographer should see cross-sectional views of the tendons of both the fibularis longus and brevis muscles. As the transducer is moved posteriorly towards the Achilles tendon, the sural nerve will become in view. The sural nerve should sit just lateral to the Achilles tendon, which is why it can be injured in Achilles tendon repairs. The nerve may appear slightly hyperechoic and a few fascicles may be seen. From this position, the sonographer can now choose whether to follow the nerve proximally or distally. We will move proximally first. As the sural nerve is scanned proximally, the short or lesser saphenous vein will run alongside the sural nerve. Doppler flow can be used to distinguish between the vein and nerve. Too much pressure will collapse the vein and only the nerve will be visible. About 6 centimeters proximal to the lateral malleolus, the sural nerve will give off one collateral branch, the lateral calcaneal branch, which innervates the lateral portion of the heel. A sural nerve biopsy may be performed at this site in the lower leg for clinical indications of suspected inflammatory neuropathies. It is also at this site that a peripheral nerve surgeon may extract the sural nerve for use as a potential nerve graft donor. As the sonographer continues proximally, the sural nerve will become more superficial around the mid-calf as it passes between the two heads of the gastrocnemius muscle. This location is called the superficial sural aponeurosis. If this area becomes a thickened fibrous arcade, it is a potential site of entrapment of the sural nerve. Entrapment at this site would present with chronic pain, numbness, and tingling down the posterolateral portion of the leg and lateral foot. Still proximally, the sural nerve will divide into the lateral and medial surocutaneous nerves and can be difficult to view with ultrasound. The common fibular nerve contributes to the lateral surocutaneous nerve before dividing into the deep and superficial fibular nerves. The tibial nerve contributes to the medial surocutaneous nerve before diving behind the gastrocnemius muscle. These two portions meet in the distal one-third of the posterior leg. The origination of the sural nerve is variable in each scanned individual. Most commonly, it receives portions from both the common fibular nerve and tibial nerve. However, this can vary. Some individuals have contributions only from the common fibular nerve, others solely from the tibial nerve. Rarely, the sural nerve can branch directly from the sciatic nerve. Returning distally to the short axis view at the lateral ankle, the sural nerve then runs with the saphenous vein deep to the fibularis tendon sheath, between the calcaneus and lateral malleolus. Approximately 2 centimeters distal to the lateral malleolus, the sural nerve will divide into its terminal branches. The lateral branch, ending in the lateral border of the foot, and the lateral dorsal cutaneous branch, which combines with the superficial fibular nerve in the dorsal foot and the lateral branch. This completes our demonstration of the sural nerve. Please check out additional education materials from the AANEM Neuromuscular Ultrasound Instructional Video Series.